everybody, and welcome to episode 8 of the Caring View Chat Show. So I hope you are all okay tonight and coping with this heat. I think we're all being typical Brits. We've all completely moaned that May was far too cold. We're all there with our heating on and our blankets wrapped round us, and all of a sudden now we're all moaning that it's far too hot and we want the cold weather back. Anyway, hope everybody's managed. Okay, Adam doesn't want the cold weather back. Hope we've all managed at work okay anyway. So tonight we are back as a foursome. Yay! So after 3 weeks apart due to mainly my holiday and then Mark enjoying himself for a week in Yorkshire, we are all back together tonight. Now tonight's topic is the DSPT Toolkit. And I'm sure there are some of you out there going, what on earth is she on about? So the DSPT Toolkit is basically, it's an NHS product and it's something that all care homes have to complete. It's all around our NHS emails and basically GDPR, so General Data Protection and Security. So it is quite a heavy topic. It is quite a heavy document to complete as well. So our aim tonight is to give you a little bit more information on exactly what it is and why we have to complete it. But first of all, we actually have done a poll just to see if people actually are aware of what it is and whether people have actually completed it. And as you can see, which is quite nice to know, and hopefully our guest tonight will be quite happy, that the majority of people have already completed it. We've still got 31% of people who haven't, but the good news is that it doesn't have to be done till the end of June, so there is still time, and a small portion of people actually don't know what it is. Now, we're hoping that they aren't care home managers, or there might be a little bit of a problem there. But yeah, very interesting on our poll there. So before we bring our guest in, we're all going to be very open and honest as care home managers kind of ourselves. Now, Mark actually doesn't complete this anymore because he's now actually longer care home manager, but I am willing to go first. So I'm one of these people who, when I've got to do something, I will do the majority of it sort of straight away and then put to one side the bits that I'm not quite sure about, have every intention of coming back to them and then come back to them probably on like the very last minute. So I'll probably end up completing it the day before the deadline. I have completed all the mandatory parts of it, which hopefully our guest will explain this, but I have still got the other parts to complete if I wish. So come on, open and honest time. Adam, what have you done?
I did it. I've done mandatory. I did standards met to get my NHS email because I like shiny new things. The NHS email was like shiny new things. So I did it way before the pandemic where everyone was like, oh, you've got to do it to get your NHS email. So I feel quite proud about that. Didn't touch it last year, which I know hand slap, but there was this pandemic thing going on, which just like sort of kiboshed everything. And I must admit, I did log into it today thinking, oh, we're talking about it tonight. Let's log in and see what my status is. Yeah, so I've only done mandatory. So I need to do a little bit more, but I do think it's great they're raising our own awareness of data breaches in data protection. So, and we'll get into it more when Claire joins us. Just to remember, though, that after we've had Claire on talking about the DSP Toolkit for what's going to be a fabulous 20-25 minutes, we are doing a catch-up on the whole Cummings and Hancock debacle. So for anyone watching this who might not be interested in the DSP Toolkit, or Cummings and Hancock, I can't wait.
Definitely, yeah, definitely stay tuned. Absolutely. So going to Dawn, where are you at with it, Dawn?
I have done absolutely none. I'm going to be honest. I hardly knew what it was until probably 6 months ago. We were actually handed NHS emails at the start of the pandemic because obviously the service didn't have any. So they literally went out of their way to make sure we had NHS emails because obviously everywhere was locking down, doctor surgeries weren't coming out. We needed that facility. So it's kind of gone by the wayside, and it wasn't until the last month or so ago that we actually thought that maybe we should start prioritising it. So we haven't done a lot at all. In fact, we had a look at it today at the mandatory sections, and probably tomorrow we'll start adding a little bit more in.
Like I say, you've still got a month done. You'll get it done, definitely. And Mark, I know you're not completing it now, but probably in your current job, you may be supporting other managers to do it. But what was your experience of it before?
So I'm sure Claire will touch on this, but I think the whole process has changed. So I actually need a gold star because I did it in March last year. So I am like you, Donna. Once I get something, I like to do it straight away, but I don't like to leave like the last things. So I just did it. And I remember sitting in a hotel room in Manchester at about midnight, messaging Claire on Twitter, asking for advice, just because the process was so long and confusing. So I am pleased to see that it has changed.
Yeah, it does feel a bit like you're repeating yourself on some of the questions, and it does seem to kind of go on and on and on. You do get to a point where you're like, are we anywhere near the end of this yet? But anyway, I think it's time to bring in our guest. So our guest tonight is Claire Sutton, who works for the National Care Forum, and she is the queen of the DSPT Toolkit. So she's now going to tell us all about it, what it is, why we do it, what happens to it, and basically to give us all reassurance that we're fine and we can get it done on time. So welcome, Claire.
Hi, lovely to be here. It's so nice, this. I don't think I've ever been on a chat show before.
Well, you are now. So,
Okay.
what is it?
Right, so DSPT it's a self-certification process whereby it helps you to audit where you're at with things like your information security, your data governance, your policies and procedures around that. And if you're using electronic care planning or any kind of digital solution, it helps you to be able to basically get all your ducks in a line. It's not policed. It's not something that you can pass or fail. It's self-certification. So if you go through the process of completing the DSPT, then it helps you to be reassured that you have everything in place in order to be compliant and therefore open the doors of having things like NHS mail and having access to things like GP records in nursing homes, and there's various other little things that you can get. Now, there was a waiver put in place, as you all know, at the beginning of the pandemic, so that the NHS could get NHS mail out to maximum number of care providers. So what they did was they basically said, look, you don't worry about the DSPT for now. Fill out this form. You just need to fill out one form, give us 2 names, and we'll set you up with an NHS mail. And actually, the waiver is still in place up to the 30th of June. So anybody that hasn't yet got an NHS mail account, you can still get one. You just need to go onto digitalsocialcare.co.uk, and the process is all on there of how to do it. Also, the process for how to complete all the DSPT is on there. So there's loads and loads of resources for everything from how to first get set up and logged on to going through that whole process. Now, I know you've touched upon the fact that there are some requirements that are mandatory and some requirements that are not. Depending on which ones you complete, that shows whether you go in at approaching standards met, or exceeds standards. Now, exceed standards is a pretty big deal, and not very many organisations have done that because it requires an awful lot of work. You've got to get things like Cybersecurity Essentials Plus and things like that. It's a provider. To put it into context, there are some massive NHS trusts that haven't even hit that. So do not be feeling that you've got to go in there and hit every single box. You haven't. If you can get to standards met, that's absolutely cracking, and that shows that you've got really, really good processes in place in order to be able to prove everything to anybody that might ask. So you might find that CQC will start asking if you've completed the DSPT. You might find that some of your contracts will mandate it as well. So some local authority contracts and some NHS contracts, depending on what sort of care setting you run. There isn't a sort of, ultimately they could turn your NHS mail off. That's the big sort of threat at the moment, that if you haven't completed this, then you could lose that NHS mail, which I know for a lot of care providers has become very, very important over the last 12 months. Hopefully they're not going to do that. There's loads and loads of stuff in place to be able to support care providers to get through this. And the waiver is in place until the 30th of June. So what you need to do is make sure that even if you can't complete it by the 30th of June, get registered, start completing it. Make sure you're up and running with that. You'll find that when you log on, some of the questions are really, really easy. You'll absolutely blitz through half of them because half of them are tick boxes. Have you got this policy in place? Of course you have. Of course you've got these policies in place because you wouldn't be in care if you didn't. Have you got somebody who's in charge of this? Have you got somebody who's in charge of that? What date did you last do it? Really, really simple things. There are some that take a little bit longer. Once you've done those ones that take a little bit longer, it's a case every year when you go resubmit your DSPT of you going through and making sure that that is still correct and just updating them. So yeah, it's going to take time the first time around, but it's to dedicate weeks and weeks of your life to every year.
I mean, that exceeding standards sounds like a challenge, if I'm honest, and I'm super competitive. Like, I don't like people being better than me at anything. I'm going to finish a game of Mario Party off tonight, and I want the most stars when we finish it. So I'm going to get exceeding standards now. That's it. Come watch me next year. I'm going to do it. I'm going to do it all. But you know, just going from what you're saying, Debbie in the chat, yes, about the NHS email being so important, but that there are people out there who probably have no idea about it, but once they log into it, will be absolutely fine because they'll realise they're actually doing most of it already. You know, simple little things. You know, how do you make sure that no one gets the data off your computer? Well, my computer's password, and no one has the password. You know, simple things that people don't actually think about, but they've actually got all these protection tools in place. So, yeah, I sat down and I did a little bit extra today. My mind's wearing now. So, yeah, I know we've mentioned it being onerous, but get your thoughts juices going, I guess. You know, and if we're going to, like Donna, you know, we've spoken, and Dawn and Mark, we've spoken a number of times of trying to utilise what we do to promote our services to the people that use them. What's more beneficial than going, actually, duty of candour, look at this, we've completed our data protection toolkit. This is how open we are and how honest we are. This is how much you can trust us because your data's safe with us, your loved one's safe with us ultimately, but also so's your data. So, you know, use it on that angle, you know, show off with it.
It is, and it's a massive thing nowadays. I mean, I've got to admit, when GDPR came in, I mean, being a standalone care home, you know, I haven't got regional managers and support managers above me. It's very much me who kind of writes the policies. So when GDPR came out, I was kind of like, oh my God, I've got to make sure I've got this in place. And I'll be honest, I actually found the DSPT Toolkit quite useful in helping me to write the policies and knowing what to go into it. And it really made me realise, I mean, we hear so much about bank account information getting taken. I mean, there are people whose living it is to ring people up every day to try to get the bank details from them. Let's be perfectly honest, they make a living out of it. We hear all about that. We hear all about, you know, people can get your information and the scammers that take your page off Facebook and all this kind of thing. I don't think we actually realise the information that we are dealing with. And as care homes, we have to work with both the NHS and with the social services. We have to work in partnership with them. And we are handling not only sensitive information as in people's, you know, date of birth, addresses and NHS numbers, but their detailed medical history. Now, would any of us now live on this chat show want to tell each other all about our medical history? Some of it we don't want other people to know about, or Adam's quite happy to share his entire livelihood with everybody.
I'm on Twitter.
You know, some of that people don't want to talk about the past and things. And when we're asking GP surgeries for somebody's medical summary when they're coming as a new admission, there is their entire life story on a piece of paper that is being sent over the internet. And I think that's what made me realise the importance of it, is the actual information that we're handling. And I think not everybody sees that care homes do that. I think they think that the only stuff that we deal with is probably the here and now, their activities of daily living, the current medication that they're on, but we need to know about their entire life in some ways. And I think it is important. And as much as, I'm not denying, it's kind of like I've got to fill it in, there is a lot of importance behind it. And I, for one, love my NHS email, and I send so much. If I know that I am sending something and it's got in it something about somebody, and I put myself in their shoes, but I want anybody just to look at this information, I will always send it on my NHS email as opposed to my work email. And it certainly made me think. But I mean, Claire, coming back to you. So when we actually submit it, what actually happens to that information? Who actually kind of sort of looks at it?
So it doesn't get looked at. So it is entirely a self-certification process. There is an audit process in place, Adam. So don't pull that shock face. So there is an audit process, but there isn't somebody that's policing every single thing. It is up to you to ensure that it is completed correctly. If something goes wrong, then it is something that could be scrutinised. So it's very, very important that you do sort of complete it to the best of your ability. You're not alone though. There's so much in place to help you get through it. So there's great resources on digitalsocialcare.co.uk, but more importantly than that, no matter where you are within England, there are regional supports in place. So all of those are on Digital Social Care. You can find who your regional support is there, and be put in touch with them. And they're running local webinars, regional webinars. In some instances, they're able to actually give a dedicated person to be able to come and help you if you're really struggling with it. It's not that you're just going to be asked to go out there and go for it alone and wing it. There's so much in place to be able to support you through it. Nobody's expecting you to just switch this on and be able to do it.
No, that's really good to hear. And I'd like to think if after this, after the show, we will share all those links. If you can forward them to us, Claire, we'll share all those links on Twitter and on our Facebook page, because I don't think everybody does realise that there's that help out there. And I've got to admit, I've looked at some of the questions and thought, what quite is it that they're on about, because at the end of the day, most care home managers are either nurses or come from a social work or a caring background. So some of this is quite alien to us as well. And I think perhaps we do. Go on.
Sorry. I think one of the other things to sort of bear in mind is your statistics that you showed at the beginning, that big number that said they don't know what it is. That could well be because actually if they work for a chain of care provider settings, that it's being handled at head office level. So it's not necessarily that every registered manager will be expected to complete this. So if you are a registered manager within a group of care settings, it's a really good idea to contact head office and find out whether this has been handled at head office or whether individual settings are expected to do this. It's a question that you really should go and ask, because otherwise, if you just assume, oh, head office will be handling this, and it's not, it's meant to be you that's doing it, then it's going to be you that it comes down on. The other thing as well is if it is being handled at head office, ask head office to send you the information that's on there, because we all know that when the CQC come and knock in, it's not head office's door that they knock on, it's your door. And if you're being asked questions around the submission for the DSPT, you want to make sure that you know the answers to those questions. So if head office are being brilliant for you and are submitting this for you and going through all that process, just make sure that they're looping you in and keeping you informed as to what's on there.
Yeah.
I mean, totally. I mean, as providers, we wouldn't expect there to be policies in place that we don't read. Mark, you're coming at this from a different angle, being big top regional. So how does this affect the people, that you regionally manage?
I think for me, because we're a franchise, they're a limited company, so they're in charge of their own DSPT toolkit. So it wouldn't necessarily be done by head office. So a lot of the franchise businesses would be the same. I think one thing for me that when I put the survey out, the comments that I had were the amount of domiciliary care companies, not even franchises, that didn't realise that it applied to domiciliary care. They thought it was just care homes. So I have shared the information with them, but that might reflect on some of that that I didn't know anything about it because they obviously didn't think it was anything to do with them. But I think that's quite worrying that there's a lot of domiciliary that don't think it applies.
Yeah, it is. Yeah. Yeah, definitely. So what's this audit that you're on about then, Claire? Tell us what you're looking at.
So as part of the Better Security, Better Care programme, which is the programme that's been put in place to support care providers to get through the DSPT, part of that is to look at a sample of submissions and go through. And again, it's not a pass or fail, so we're not going to be auditing them to turn around and say, that's a terrible submission, you're losing your email address, get to the back of the class. It's not about that. It's about, if you get pulled for audit, we'll go through it, and it's as much to educate us as to how good our resources are as it is to then be able to help you if you need to make changes to your submission. So we'll ask for things like copies of the policies that you've said you've got, and make sure that they cover the things that you've said they say. And if they don't, then we'll be constructive about it. Nobody is going to get a fail. This is not a pass fail situation. It's about saying, smashing, you ticked every single box, and your policies and your spreadsheets, the ROPA and the IAR, which are a couple of documents that you produce as part of the toolkit, they're gold star. They're absolutely brilliant. We want to print them out and put them on the side of a bus. But you're not going to, equally, if they're not brilliant, what we'll be able to do is help support you to make them brilliant. And again, that's where that regional support comes in. That it's so good. Every single part of the country has got people that are being funded to support you through this. And there will be some care providers that don't need any help whatsoever. And there'll be some that will just be able to dip onto digital social care and pluck the bits that they want. But there'll be some that really do need that extra support, and that extra support is in place.
I honestly think this conversation tonight, I know we've not worked like this, we'd be, superstars and millionaires if our brains actually worked in some sort of coherent linear fashion, but they don't. But I actually think tonight's conversation is a wonderful sort of closing of the first few episodes that we've done so far on this channel. So we've spoke about digitizing care, and we need the DSP toolkit for that. We've spoken about peer-to-peer support, and I know the groups that we're in, Mark, people cry out every single day that they don't know what they're doing. Can they have some support on it? And we've seen people be helped, through that. And then we've seen digital marketing and using our own websites and social medias and everything like that. And we need the toolkit for that. So this is like a sort of, everything we've spoken about so far on the channel may sound more fun than doing this, but this is really important and really required. And even if you don't even think of it like that, if you're one of those managers that's crying out for integrated care, well, I'm telling you, we need to do this if we want integrated care. So, a bit boring, but the benefits from it far outweigh from what I'm hearing anyway.
It's not boring. Stop calling it boring. It's wonderful.
I think one thing I found, though, when I completed it, is similar to what Donna said. When you send that email from your NHS email, nobody questions. They're not like, oh, can you now resend it with a password, or what is, everything's just sent. There's not that, oh, can we check where you're coming from or who that's about, or we can't send it to you. Because once you've got that email address, people seem to, it's because the NHS, isn't it? And people just send it through to you. It just made everything so much more streamlined and time efficient.
Oh, gosh.
Will I get told off for this? Because I've used mine for benefits. Like, I get free delivery from Morrison's with my NHS.
Well, your blue light card.
Use your NHS mail to sign up for a blue light card.
It's awesome.
I've got one.
Stuff.
Discounts on websites. Yeah, you can do all of this. Not really supposed to. Yes, you can.
I got 15% off my Chili's bottle.
Hey, we're all into benefits, definitely. But I'd just like to come back to Dawn, because you're the one that was very open and honest and admitted, I haven't done it. I didn't even know about it until six months ago. So just listening to Claire there and all that support that's out there, do you feel a little bit more confident that you'll be able to get it completed by the end of June?
I think we all know I don't feel confident when it comes to things like this, to be honest. But I do, now I know there's somebody regionally that I can pick up the phone to or email. It does make me feel better, because when you do look at it initially, it does look like a concern to me, to be quite honest, especially as we had our NHS email kind of handed to us on a plate, because they had to give it to us because we needed it due to the pandemic. I think that now, knowing that there's that support there and someone that can help us, like you say, I know full well we've got most of it in place already because we have to, but it's just, to me, I will admit 6 months ago it felt very monotonous, and it felt something that, did I really need to get this done? I'll leave it, I'll get somebody else to do it, I'll get someone else to help me. But now I understand the prevalence and how important it is.
There is a helpline available as well. So Digital Social Care have got a helpline that you can email or phone. It doesn't operate until 11 o'clock at night, I'm afraid, Mark. But 9 to 5, Monday to Friday. If you phone on a Wednesday, it'll be me that picks up the phone. But yeah, so even if you've got like questions you think might be a daft question, you can ring the helpline. And again, that's on digitalsocialcare.co.uk. It is kind of more depth information. We will send to whoever your regional contact is, and all are listed on there. So please, to think of any care provider sat there looking at it, struggling and thinking, I don't know what I'm doing with this, because here to help you. The world will be a better place when we talk through digital means. I'm a registered nurse. I come from a background of working in social care, and I have been working in a care home where the fax number was 1 digit different to a local car fix. So you can imagine the sort of faxes that used to come through. And if we got their faxes, there's a good chance they probably got ours. And having email solves this.
So I'm going to ask a question that probably some people might also be thinking. So how do we know, and what is it that you do that make NHS email so secure? Because we're obviously all saying that we're really confident with them, we're happy to send everything. So what is it about NHS emails?
It's end-to-end encrypted. So it basically means that it's going across a secure connection. So if you were to send information across a non-secure email connection, so from like Hotmail or Yahoo or Gmail or whatever, then it's not a closed circuit, so it can be accessed at other points, which it's an added layer of security to be able to use secure end-to-end encrypted. And if you're doing it from an NHS mail account to an NHS mail account, it's just going from point A to point B. It's not going across, it's not beaming across the world, across all kinds of different servers or anything like that. So it's that additional security layer.
Yeah.
And I think that's what's so important, even if we're not talking NHS mail, because we don't use the NHS mail for everything. You don't get, I definitely don't get enough email addresses on the NHS email to give to all my team. But yeah. I need to email my team confidential information daily anyway. So we've had to get a separate emailing system that does end-to-end encryption. I'm going to plug it because I think it's fantastic. Proton Mail is a free one out there that is end-to-end. It's all kept on your servers out elsewhere, or it's all deleted. I don't know. It passes the GDPR and data protection test, so that's great. And Mark, I know you love a WhatsApp group. WhatsApp as well is end-to-end encrypted, as far as I'm aware, as well, isn't it? So it's all about that end-to-end encryption.
It is. The problem with WhatsApp is it's a bit like if you sent an email to 20 recipients and didn't BCC the recipients.
Oh, Claire, I'm so glad you brought this up. It is my biggest bugbear. In my email inbox right now, there are 848 unread emails, right? And I'm going to say 90% of those are replies to emails where everyone has been CC'd in and not BCC'd in. And it's my biggest bugbear. If we're emailing people, put them in the BCC. You don't want everyone knowing the emails. We don't want everyone to have contact with the emails unless we've explicitly given permission. So shove us in the BCC. And if anything, when someone hits reply or reply all, it won't send it to all 200 people that were on that original email. Oh, I knew there was something I wanted to say. I'm so glad you brought it up. Sorry to interrupt you, Claire.
It's all right. But that's why WhatsApp is bad, because actually you've got everybody's contact details.
Yeah. But that is very true about the BCC, and I find that an email will come out from mainly probably from social services, and it will have absolutely every single care home in the whole of Sheffield on or whatever, which fair enough, it isn't too much of a problem, so we could probably find those email addresses out. But people then always click on reply all.
Yeah.
Rather than just reply to the person who sent it, reply all. So like you say, you end up with like 100 emails of every individual person's reply, and some of them are not for our eyes. So I think that's another one as well. And everybody clicks on reply all as opposed to just reply to the person who sent it. So yeah, I think there's some things round about being email savvy. And I've got to admit, I send out a weekly email to all of my relatives, and obviously they are personal email addresses, very personal email addresses, you know, and I put them in BCC because I haven't even asked their permission. Are you happy for me to send your email to everybody else? But I don't need to ask that because, you know, I'm not doing. And some of those things which to us might seem very basic, some people just genuinely don't know about, you know. And you know, me and Dawn, we are the first to say, you know, Mark and Adam are way ahead with us with technology and doing all this TikTok stuff and all that kind of thing. You know, we're still quite dinosaurs at this, but stuff is moving on so rapidly. And I think we've learned that this last year. We've all learned how important technology is, and it's not going to go away at all. If anything, it's going to get even more. So all these little hints and tips. So I know we're going off a bit of a tangent now on DSPT, but it's all to do with, you know, just general emailing and just hints for people to send a safe email. And, you know, perhaps we can put together an article and we can share it on just, you know, a bit of a bullet point on how to send a safe email, because we don't use our NHS email all the time. I would say that all of us, majority of the time, use our own care home email, and there probably are just some very basic points that we can perhaps send out to everybody, you know, on our Twitter or our Facebook page, of just some general, even just like housekeeping rules that we should all be sticking to when we're sending out emails.
In fact, Claire, platform for it. Top 3 tips of email safety. What have you got for us?
Never click on a link or an attachment where you don't know where it's from. That's definitely number 1. BCC is your friend, because otherwise you're giving out people's information to people that don't necessarily need to have it. And I think just being really aware of the email address that things are sent from. So quite often, like I've had one today, and it said Amazon customer service, and it was like, your account has been logged into in Cincinnati. I'm like, no, it hasn't. So I clicked on the Amazon customer service, and it was like blah, 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 at blah, blah, blah. I'm like, yeah, total scam. But if you'd seen that, you might have thought, oh heck, it's Amazon, something's happened, and clicked on it. So I think just being kind of savvy about things goes a long way, because there's been massive increases on personal cyber attacks over the past 12 months. There's been increases in hitting organizations and companies as well, but individual targets, like, it's just gone up massively. And you get text messages saying like, oh, Royal Mail, we've failed to deliver something. And like, that to me is probably quite believable, because there's usually some fabric arriving every day. But it's so easy to just think, oh, I should do that, and you're in trouble.
Yeah.
And they get so good at it now, these display names, you know, because they do look legit. I mean, the ones that come from Africa that say we're going to transfer £10 million to your account because we think your website's lovely, you know, we've had it inherited to us, then yeah, you know, fine. But those ones, especially when they come, the worst ones are when they're like, oh, your password going to expire, log in now and do it. Put in your old password. Oh, you're done. Yeah. You gotta be careful out there. Yeah, gotta be careful.
Definitely. But now, I mean, I certainly feel more reassured. I mean, it's something that I've done for quite a few years now, and you know, I've not been too unhappy filling it in. But I think hopefully we've expelled a few myths about it, explained what it is. People aren't quite so afraid of it. But I think more importantly, which we just kind of sort of ended on there, is why we're doing it. So even though it might be, yes, it takes a bit of time, and yes, you've got to tick some boxes, and yes, you've got to, you know, look at your policies and everything. it's why we're doing it in the first place, and we're doing it for the safety of the information that we are caring for, and we're meant to be safeguarding. We've got a duty of care to them. It's like you say, you know, it's what we're meant to be doing in our jobs, and it's just part of it. So get on and get it done. You have 29 days left to do it, and if not, contact Claire. Her Twitter is going across the bottom. She is going to be bombarded with messages on Twitter now.
At 11 o'clock at night from hotel rooms in Manchester.
Yeah, absolutely. Yeah, you want to be careful. I've warned you. It's a scam. Don't ever reply to anybody who's contacting you from a hotel room at 11 o'clock at night, Claire. Yeah, big warning. Don't do it.
The only other thing that I would say that I do that isn't really digital, but it's over the phone, is, and I started off this just to be a little bit passive aggressive actually, because it used to wind me up when I used to phone people and they used to ask for, you know, their pet's first name before they could divulge any sort of patient records to me. But I am fed up with people who phone me on unknown numbers, because we have caller ID at our place. It's all managed by someone else, so I don't have to worry about that. But they phone on the number that you don't know, and they'll go, can I talk about Joe Blogs, please? Can you tell me when the last time he was seen? I'm like, yeah, sure. Joe's date of birth? Oh, well, yeah. And what was his last known address? Oh, right. Okay. And I actually asked them now for that information before you even divulge anything over the phone. You don't know who they are. And if they can't give it yet, really, really sorry. Phone me back when you know the information. Because they'll get you anyway, won't they?
Yeah, that's really good advice. Yeah, really good advice. So thank you, Claire. Any last tips or reassurance that you would like to give to all the viewers?
Don't be a stranger, I think, is the main thing. You know, there is so much information out there. There's a whole package of support in place. If you are stuck on any of it, there's no such thing as a daft question. There's loads of resources, and just get in touch. digitalsocialcare.co.uk. All the resources are on there. The helpline number, the email address, everything. If you're stuck, just get in touch and we will put you in touch with whoever your local and regional support is as well.
That's brilliant.
Fantastic.
Thank you so much, Claire. Really, really, honestly. And it is interesting because it's something, like you say, we've got to do. We can't shy away from. So let's embrace it, guys.
Give us that website again, Claire.
digitalsocialcare.co.uk.
Can I spell social? Yes, I can. .co.uk. Fabulous.
While Adam's doing that, with this, I don't know how legal it is, but what I did is, because our local authority did this a few times and copied everybody into the same email, I took the email addresses and I emailed everybody and I said, why don't we start a WhatsApp group? We had every single provider in Essex, or near enough all the providers in Essex, on a WhatsApp group through the pandemic. And it was amazing for sharing information, for networking, when talking about fees, because there's always seems to be this competition about, we're not going to pay this much because so-and-so down the road isn't. So actually you could pick up the phone to the manager of that home and say, actually, do you pay this? Or what are your charge rates? And it was great as well if you had somebody whose needs had changed and you couldn't meet those needs, of networking with other managers locally so they could stay within the local area and say, look, we've got this gentleman or this lady, needs to change, we can't meet them. Is there anybody that's got, and I've seen the group work where the homes are shutting down and they've said, we've got, 10, 13, however many, residents that they've got that all need rehoming. And actually people have been able to say, I've got capacity or I've got capacity, or they haven't. So it just shortcuts that as well. But I don't know how legal that is. So I don't want to advise anybody to just go on an email. But I think if the email address is in your inbox, if you're not adding people, if you're asking for their permission first. But I think for us, it's been, in Essex, it's been really good.
It's not illegal, but obviously if somebody said no, they don't want to be part of it, you just got to respect that.
Yeah. Well, at the end of the day, they had to give us all their number so they could add them to the WhatsApp group. But I think in Essex, we've got 105, 106 managers in the WhatsApp group. So we're not that big in Essex. So
that's brilliant. That's brilliant. So anyway, please stay with us, Claire. Please stay with us and listen to A Week in Health and Social Care. So I think it was last week that we were actually saying there hadn't been many updates. We kind of felt there weren't. And then
before we start,
I
think this is the point of the show where we need to remind people that these are our views. and not those of the services we represent, because we say it every single week, and every single week we're like, oh yes, and everything's wonderful and everything's grand and blah blah blah. Oh my gosh, the news this week. So just to preface this, these are our views and not those of those that we work for.
Yes, absolutely. Absolutely agree. And I think, yes, this week more than anything that we need to be saying that. So, you know, we've had quite an explosive week, really, in regard to health and social care. So we knew that this was coming. Oh, that was a word to use, wasn't it? But we knew that they were going to discuss the pandemic. But I've got to admit, I didn't think it was happening yet, because in my eyes, we're still in the pandemic. We are still in it. We are very much at risk. We've seen on the news in the past couple of days that there is potentially a third wave coming. We know that we're not all vaccinated yet. So I very much always feel that we still are in the pandemic, that we're not out of it yet. But they have already, obviously, started having this discussion and looking back. Now, I agree with it. I'm very much a person who always says we must learn from our mistakes. We must look at negatives and turn them into positives, and we all must learn from it. But I didn't realise that Dominic Cummings would be the first one to be interviewed. So I am not going to start on this one. I'm going to go to Dawn, who's been sat there in that corner, all very quietly, and say, what did you honestly think to what Dominic Cummings said? And do you think he was telling the truth?
Yeah, I do. And only because I have the lived experience. So I know that there were residents sent back from local hospitals in Norfolk and Suffolk positive with COVID, and they did not inform the care homes. I know that there was colleagues and other registered manager friends of mine that had paramedic crews turn up at 11 o'clock at night, even though registered managers had said no. So I knew this was all going to come out eventually. What I didn't know was to the extent where he would come across in so much detail. And I think that to me, he doesn't have anything to lose anymore. And I do think he's quite genuine in some of the stuff he said, in respect of that he is really sorry, because he did look really sorry, and he did come across to me like he was apologetic, and it was something that had plagued him. I haven't been there and done it, but it is frustrating to me as well, because why did we have to wait for Dominic Cummings, who had already lied about his eyesight in Barnard Castle and everything else that went on, in order for social...
Oh, have we lost
somebody like Dominic Cummings to have to come out and actually speak the truth?
Yeah,
that's my frustration.
Yeah.
You see, my biggest bugbear on all of this is exactly like you, Dawn. Why is it taking something like this for people to be recognising that there was a massive, absolute screw up at the beginning of last year? But my biggest issue on this is I actually think Mr. Cummings is actually very disingenuous with all of this. And it is, you know that saying, hell hath no fury like a woman scorned. He is out for blood. He's out for revenge. And if he's going to sit there and go, yeah, Matt Hancock messed up with this, and he lied about this, and he lied about this. Oh, by the way, I made some mistakes too. Then everyone's going to go, oh, well, he must be telling the truth because he's ready to admit some of the fault himself. But he actually literally laid in so heavy on the government that you sit there and you think to yourself, are you using the crisis now of the social care system from last year to your advantage to have some levy to get your own back at the people that you were working with last year and that you're no longer working with? And yeah, I get that he looked upset, but this is the same man. This is the same man who walked out of Downing Street with a box from his desk with a potted plant and his name plaque and stuff in. No one does that. This isn't no one walks out their blooming office with a cardboard box. Oh, you can keep all my rubbish if I get sacked. I don't want to take it with me. I've got nothing of importance. So I do think some of it is an absolute charade and a farce. And I think it's insulting to the people who have lost their loved ones, because all they want is answers. All we want is answers. I want answers for Dawn, who went through absolute hell last year. And I don't think we'll get it, because I think it's just going to turn into a game of tit for tat now. And we'll very much show the day after when Matt Hancock went on his briefing and basically either ignored to answer any of the questions or denied it all. So I just feel like it's going to get swept under the carpet. It's going to be a bit of double jeopardy. So that in a year's time down the line, when we want to have a proper inquiry about it, no one's going to discuss it because we've already discussed it now. Because Dominic Cummings used it as firepower to get what he wants to get his own back. I don't know. I just feel like it's insulting to those who have gone through all of this now. But my opinion, not that of the business I work for.
No. For those who don't know Dawn, I mean, obviously, you've just said there that you do believe him because it happened to you. So those who've not seen previous episodes, do you mind repeating the story about the gentleman who you actually had admitted from hospital?
So one of our gentlemen went into the local hospital with something not COVID related. It was an infection. He came back. We were reassured that he hadn't been near anybody with COVID. He hadn't been on their designated COVID bays at the time. We asked if there was an opportunity for him to be tested. We were told no, there was absolutely no need. And then a week later, we had probably 11, 12 residents with COVID. And the only way that we knew was because they were then being admitted to back to the local hospital, including that gentleman. So he then tested positive in hospital, and they rang and said, we think he's had it for a while. And then you were literally walking around the building wondering who had it and who didn't. And in the end, we lost 9 residents. And the impact on the staff and myself and the other residents and their families was horrific. And knowing that the hospital at the time knew that he could have been positive and then knew that he was positive days later, nobody rang them home to tell us. Nobody. We were walking around with guidance that told us 1 minute to wear PPE, not to wear PPE, not to do this, do that, keep the windows open, don't keep the windows open. So to me, I knew this was going to be the outcome. I knew that somebody in the end would have to say that they were sending people untested into care homes, because we all had the lived experience. And I think that to kind of blanket that with the no, we had to do testing capacity, and no, we had to do this. I think it's time everybody held their hands up and just said, like you said, Donna, earlier, we've learned a lesson, we've made a mistake. Let's give these families what they need as well, that little bit of peace.
Yeah.
So what month was it, Dawn, that you had this outbreak?
In April last year, April into May.
So, I mean, if we take Cummings for his word, this is what, 3-4 weeks after he texted saying 500,000 people are going to die. SHI, you know what, is going to hit the fan. So you're going through that, Dawn, and they're sat in wherever they're sitting, discussing this, going, oh yeah, things are going to get tough, but you're out there living it as it is.
I mean, I've heard that story from you, Dawn, now easily 3, 4, 5 times, and it still is such a powerful story and still hits home. And we all know that you're not the only care home that's been in that position. We all know of probably a local home that's been in that position, and it is so sad. And for them to say that they put a ring fence around care homes, I mean, that sentence alone kind of grates on me a little bit, because it really is like somebody wrapped their arm around us and said, we are going to protect you because we know that they're the most vulnerable. And for them to say that they did that, there is no evidence of it. I mean, coming to you, Mark, I mean, one of the things that Matt Hancock said in reply to it was, we didn't have the testing capacity. I tested as many people as I could, but we only could test 2,000 people a week. So if that was the case, if they could only test 2,000 people a week, I don't know, this is a massive question to ask you, Mark, but perhaps what should they have done then? Who should those 2,000 go on? If they were already saying that the most vulnerable, if you remember at the very, very beginning, everybody over the age of 70 was told to isolate. Now, I personally had 3 members of staff over the age of 70 who are extremely fit and healthy and honestly, there was absolutely really no reason for them to isolate, but that was one of the very first things. So right at the beginning, they said that the elderly were the ones that were the most vulnerable. So what would you have done with 2,000 tests a week, Mark?
Do you know what? It's easy on reflection, but I think they should have just put their hands up and been honest and said, look, we've got 2,000 tests a week. We know that's not going to cut it, and we're working on it. But at the moment, we've got to prioritise somebody, and we don't know who to. It's no different than how we as care home managers or those of us, managing domiciliary, had to choose which residents or clients we were going to go and see, which ones we were going to save if the virus entered our care homes. We had to hold up our hands to our relatives and say, look, we're not going to prioritise your son, your daughter, because we've got somebody actually that is more clinically vulnerable than them. We've had to put ourselves through that. So, and I think, us working in social care, we would have respected that. And I think the general population would have respected that. There definitely wasn't obviously any testing for learning disabilities until months down the line. So they definitely weren't prioritised. And I think what annoys me with the whole press conference is that it just overshadows everything else that's happening in social care at the moment. And I think, it's been 10 years since Winterbourne View. For anybody that hasn't seen it, if you Google it, the horrific abuse. But yet there's still over 2,000 people, mainly girls with autism, but not a learning disability, still locked up in prisons. And I feel that announcement has overshadowed the fact that the government still hasn't put plan into action, to get rid of these lockdown units that, there are so many places that could be funded in the community that would better meet their needs than being in a lockdown unit.
Yeah, you're quite right, Mark. Like you say, 10 years. So that's 10 years since something that was so, well, it really imploded because it was on TV. Everybody could watch it. It was there for everybody to see. Yet 10 years down the line, things still haven't really been sorted. So, I agree with you there. And you again then said there that learning disabilities, there are so many learning disability care homes, and those people are vulnerable and those people are needing care, but yet they were completely forgotten. There was no such thing as testing for them, at all, really. So I think we're all going to have to wait and see what kind of comes out of it. I mean, I think the difference is that all of us who work in health and social care, I think it's in our blood to be open and honest. And we always say that it's always best to be open and honest. If you make a mistake, if any of us get a complaint, I'd like to think you're all the same as me. If we get a complaint, what is this 28 days lark about? We will try and reply to that and sort it out ASAP. We don't go, I'll just put that one to one side because I've got a priority. I'll sort that out in 27 days. Of course we don't, because that's what we do in kind of health and social care. Obviously, politics, I know why I'm not a politician. I could never do it in a million years. I really couldn't. But, will we ever really know the truth? I think ultimately what we want is them to stand up and say, we didn't really know what we were doing. We made some mistakes. We are going to learn from them, and hopefully they'll make a change. But I think it's a bit of a watch this space, really. But certainly we all want to say well done to Adam for going on Sky News. Absolutely fantastic interview. Yeah, you most definitely acted on all of our behalfs there.
I was seething by the time I got on.
Yeah, we could tell.
I was like, be professional, be professional. I'd done talk radio, was it Times Radio, not like, 5 minutes, about an hour before that. And it was, nice and calm and yeah, blah, 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 blah. And I'm sat there listening to him on the doorstep or wherever it is that they do these blooming conferences from nowadays. And he was like, I fixed this and I've done that and I've been out saving lives. And I'm like, really? So there are people dying in this country. There are health and social care workers dying in this country. And you want to stand up there and say you're saving lives? Seriously, what about everyone who is out there doing all this incredible hard work? And not only that, I think, yeah, we do need answers, but we also need the government to stop breathing down our necks right now, acting like they're all high and mighty, vilifying social care left, right and centre, and putting such draconian measures on us to say, oh, this is how we're protecting people. I was like, no, it's not. This is you now afraid to make a mistake without actually owning up to the mistakes you made last year. We have shown that it's manageable and that you can have safe visiting. Let's just bring it down to visiting for a second. But you can have safe visiting if you do things logically. But the government, instead of saying, we're sorry, we messed up, it's a case of, right, well, you can't do this, can't do this, can't do this, can't do this. Everyone needs to have the vaccine. There is no ifs, no buts about it. And oh, look, here's Dominic Cummings on TV now, so you can forget that we've not actually mentioned about integrating social care.
I think one thing I don't understand is near enough every single member of the public wouldn't want to be in Boris Johnson's shoes right now, because nobody would know the right decision to the wrong decision. And I think if he just stood there and held up his hands and said, look, we didn't know, we took a gamble, that gamble went wrong, but actually, like you said, we're going to learn from that so that if this does ever happen again, we know what to do. I think everybody would relate to that. There's nobody here that would know what the right decision is, the wrong decision, because nobody's ever faced it before.
At least they didn't put it on the side of a bus.
Very true. The other thing I want to bring up, we've got 5 minutes of the show left, but the other thing that's been mentioned in the news this week is actually in response to what Matt Hancock said. The vaccines minister, Nadim Zahawi, he has made quite a few comments, but one of them that is made this week, which I found very interesting, was that he also feels that the COVID vaccine should be made mandatory in the NHS as well. Now, we all know in health and social care, we are waiting to find out what the outcome of the consultation is. So the date was extended to the 26th, so it's a week ago now. So we are waiting to find out whether this is actually going to be made law, and also what the kind of get out clauses are in regard to medical exemptions and things like that. So what are people's views on that comment, that it should also be mandatory in the NHS?
Well, let's not forget that it's only half of social care, because they fail to forget that there's community care and supported living. So they only want residential care homes. So God knows about, those that go into
only elderly residential care homes. Heaven forbid that you're under 65.
Yeah.
So I wonder whether they're going to do the same for the NHS, or is it only going to be, the public sector of the NHS, but not the private, or is it only going to be, certain wards? But yeah, I don't see how it's ever going to be mandatory when there's still so much, to and fro about the vaccine, and, 1 minute it's safe, the next minute you can't give it to under 30s. And, then there's a new vaccine, and the current vaccine doesn't, it's not effective against the Indian variant. There's still so many unknowns, I feel, that I don't see how they can roll something like that out.
Yeah. Dawn, what do you think?
I was looking on Twitter after the comment was made, and then there was an article written about it, and it was the absolute shock horror, and this is my own opinion, of some of these NHS workers. How dare you make it mandatory for us? And that is how it completely came across to me. There was this whole, well, why should we? Where I know full well some of these people will come in respect to social care with absolutely they should. Do they not remember what happened last year in care homes? So I think 100%. If we're going to collaborate and everybody's working together and everything's going to be an integrated system, we all need to be exactly the same. But this whole chop from some NHS staff that they shouldn't have to have it, I find quite shocking, because they were saying, well, you should also, or everybody in social care should have a Hep B and a Hep C like we do. You should also have this. You should also have that. Well, hang on a minute. So now the shoes turned. It's not turning out to be the same. I kind of find that a little bit unfair. So I was quite shocked by some of the comments.
Yeah.
I mean, Claire said in the chat, I know we've said stay on, Claire, and then we've over-talked and not give you a minute. But yeah, good job. Good luck finding a new workforce if you do mandate it. I'm going to say it because there's something I've said for ages. Just before we disappear, the only other thing that came out this week, which I know everyone will be overjoyed about, is I've decided to shelve the motion of limiting movement of social care staff for now. There was this huge consultation about it, whether care staff could work in different settings or whether we had to limit them or stop them and blah, 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 blah. Anyway, they've kiboshed that for now and put it on the shelf. So I think that's a huge bonus that, comes out of this. And it's something that kind of goes under the radar, a little bit like charging or paying for sleepovers, It's something that has been announced but hasn't really had the fanfare. So if anyone's watching this and you've been concerned about your staff moving from setting to setting, fear not anymore. They have stopped it for now.
And if they work in domiciliary, they can now get hand gel on the PPE portal, because heaven forbid they weren't eligible before.
And it smells really nice, that hand gel.
So you see, there is good news this week. There is.
I think talking about recruitment very quickly, because I'm aware of the time. is that I did read an article where there's 31% of an increase of people considering joining social care as a career, which is great news because, you know, we're going to need a lot more people. The job vacancies, you know, they're piling high. So, yeah, if you're watching this and you don't work in social care, then feel free to contact any one of us because we'll tell you how amazing it is to work in.
Yeah. You could one day pretend to be a professional like us and sit on your own chat show, like we know what we're talking about.
So, Adam, what have we got lined up next week?
Oh, I'm really looking forward to next week because Mark has been harping on about this for God knows how long. We're doing domiciliary and we're going to talk about community care. And we've got the fabulous Reina Summerson from Adjin Care joining us. Reina is an absolute fantastic person. I met her originally through John's campaign, from my work through John's campaign. And I thought, who better to have on for next week? She's had a huge presence on social media throughout the pandemic and has done a lot for all sectors of care. And, you know, I think she's going to be an absolute delight next week for us. And we can talk all things home care. No care homes, no supported living. We're going to talk all things home care. It's going to shine next week.
Yeah, well, I'm for one, I'm definitely looking forward to it because, you know, it all links in, and dom care is absolutely massive. There are so many people being cared for out there in their own homes, so I think it's a fantastic topic for us to do. So once again, Claire, thank you so much for joining us tonight. Please follow Claire. Please ask her any questions. Please go onto the website, digitalsocialcare.co.uk, and any questions that you've got, you know, Claire will be available for people if need be. Contact her through us, through our care home support page on Facebook, or through our Twitter account. So we're always there. We don't know the answers to everything. We are not the professionals, but hopefully we might be able to find somebody who does if we don't. So any last comments from anybody?
We're so close to 200 subscribers on the channel, so do not forget to subscribe to this channel and join us every week. Even if you can't join us live, catch us on catch-up. You know, but unless you subscribe, you will not be notified when we put our new episodes up or when we go live. So hit that subscribe button, share it within your network, share it within your relatives, your families, your friends. You know, social care's cool. It's not boring. Data protection tools are not boring. They're fun. You know, nothing about care is boring. So let's get into it. Let's make it a platform for everyone.
Fantastic. Well, thank you so much for all of you who are out there or getting us on catch up, and we will see you all next week. So good evening for now. Bye.